Lots of you have questions when it comes to COVID-19 and your kids going back to school.
We're continuing our conversation with Dr. Jeff Potoff at UW Health this morning to get you some of those answers. Hello again, Dr. Potoff. Thanks again for joining us.
Good morning, you guys.
Let's get right into it. We're going to start off with Chelsea's question. Is it safe to open schools?
Yeah, I think, when we look at schools, we have to look at each individual district to determine if it's safe. And, there's a few things that you want to keep in mind. And one is the district or the schools actually set up to facilitate social distancing. If they can perform social distancing reliably nearly all the time, that's a good sign. You want to look at masking requirements. Certainly, robust masking policies are very important. Sanitation policies, how are they going to do distancing at pickup, drop-off? And then particularly if your school's going to have it, lunch and recess can be tricky times. So you have to look at that. Anytime we have higher community transmission, we increase, risk for schools opening. But on the flip side, there's also risk for kids not having in-person education. So it's really that balance between those two things.
So our viewer Carrie wants to know, at what point should a school go 100% virtual? Is there a threshold of cases that school districts should pay attention to?
Yeah, there's not a particular probably number that you would pick, but I think what is likely to happen is if you have schools that start to see spread of COVID-19 during the school day, whether it's teachers or students, you'd have them take a break to try to figure out who all got exposed, who needs to be tested, who needs to be quarantined. If that rate of positive cases kind of exceeded the ability to quickly do that contact tracing, I think you'd see schools close and go virtual, at least for a period of time.
All right, we'll get to our question from Jenny now. Since most people recover, shouldn't each family make their own decision?
Yeah, I think this is a little bit dangerous logic. So although most people do recover, there is many people who don't recover. If you look at the U.S. and the international death toll, COVID-19 is a bad player. It is a bad disease, and you don't want it. The other thing that's really difficult about kind of making the decision for your family is that you're not really making the decision just for your family. You're likely to come in contact and expose other people too. So you're making that decision for more than just yourself. So I would say, for as much as we know about COVID right now, it is dangerous, and there are patients who have lingering side effects that are lasting months after their initial infection. We don't even know how long that'll go on for. So I think the right approach would be, what can I do to minimize the chance that I get COVID-19 and that I spread COVID-19 to other people?
So Dr. Potoff, you're a dad, you have young kids. How would you feel about sending your kids back to school right now?
Yeah, well, I can tell you what's actually going to happen. So we're in a school district where they're able to do hybrid learning for elementary education, and that's where my girls are at. And I feel pretty comfortable with it. They're going to be able to physically distance. There's going to be 12 kids in a classroom, one teacher, no moving around, no recess, no lunch. And like I mentioned, there is this tremendous benefit to in-person education that I'd love to give my kids. I feel like the school district we're in are taking those appropriate precautions. So we're willing to give it a try. And if things don't work out, we have the option of going virtual, but based on what I've heard and what the district has tried to do, I think it's in the best interest of my girls to try to go back to this hybrid learning environment.
Dr. Potoff, we want to thank you for your time this morning, waking up early, answering all of our questions, because we certainly had a lot. We really appreciate it.
You bet. Anytime, guys.
Have a good one.
All right.